Hi, everybody. My name is Neo. I am the founder of Technovera, based in Johannesburg. And I guess for us, we have been operating in the access to medicine space, primarily within the public healthcare space, where we've been partnering with the Ministry of Health to introduce innovations that can help reduce the time that it takes for patients to collect chronic medication. And this is very much addressing the challenge where, as a patient in South Africa, you're spending 2 hours, 3 hours, 4 hours every time you have to go collect your repeat script. We had built an innovation called Box, where we have these digital lockers, which are installed at public healthcare facilities. It would send an SMS to the patient saying, Doreen, your medication is ready for collection. Here's a one-time PIN. And the patient would be able to go directly to that self-service kiosk and be able to access their treatment without spending hours in queues. That was the work that we were, going about our way and just installing more lockers in more communities and so on. And I think when COVID hit, there were two things that happened. It accelerated the need for us to be able to increase the number of sites, primarily because the benefit of our solution ended up being highlighted as a system that decongests a clinic and doesn't effectively have a increased burden of having to have a one-on-one session with each and every patient who has to come and collect their treatment. So we ended up having to increase the number of sites quite rapidly to be able to make sure that we help reduce that particular burden. Similarly, the second part that ended up hitting us a little bit harder than what we had expected is that we would end up with some of our partners or our clinicians in some of the clinics that we operate in testing positive. And what was happening is, majority of, it was about 90% of the sites that we operate in ended up being COVID testing centers. And we ended up with a scenario where the clinic would have to close if one of the staff members tests positive. For 7 days, you'd have to clean or do a deep clean, and that would sort of discontinue the service to that particular community for a while. And there was this cry out to say, look, Technovera, you guys are building these lockers. Can you not help build something else that can help us so that we don't have direct exposure to patients? And we came up with these COVID testing booths where you as a healthcare clinician who's collecting the swab, you'd able to enter this particular booth, which has a set of gloves, and you'd be able to collect a swab for that particular patient and make sure that you have 100% isolation. And this was very much in the context of wanting to introduce simple, locally manufactured innovations that can be able to help create 100% isolation barrier between the clinician collecting the swab and the potential COVID positive client who's here. And it was very much at that point of just collecting the swab, because all of the other steps before that and after that didn't require you to be in close proximity or close interaction with the client. Some of the NGOs that we work with ended up saying, look, this is going to be something that we think is needed. And we ended up responding to that particular need at that time. So for us, it's been this two-pronged strategies of being able to improve the number of sites where patients can collect treatment in a contactless manner, thereby reducing the exposure to COVID, and then additionally making sure that patients are not having exposed extended times in a clinic, which is technically a hotspot because of the volume of people that need healthcare facilities, even during COVID. Thank you.
Thank you, Neo. Just so for you, sort of increasing demands in a way for your services and for sort of this distribution of medicine. Just one follow-up question in terms of the booth for sort of the for health professional. Was it a new technology, a new sort of line of production for you, or how have you been able to introduce this new solution in very rapidly?
Yeah, so I think there was a period in South Africa where we had a pure lockdown where there was no any economic activity. So even at the factory, we were not able to operate. So it was during that time where we said, look, we are a team of engineers that are good at building products. How can we use our hands, our hearts, and our minds to be able to create something? So it was a completely new product for us. We had borrowed a lot of the other principles that had worked quite well in China and in Japan and South Korea, primarily because they had their first wave quite early. And we wanted to then say, in the context where you can't bring in PPE, because there was no movements of flights into South Africa and so on, we ended up building something off scratch. And that was a very, very interesting period for us, because it required us to go back to first principles and say, how do you build with the resources available and the supply chain that you still have, and suppliers that currently have items in South Africa without needing to rely on items that have to be flown into the country, because that was one of the constraints.
Wow, okay, so a bunch of engineers sort of eager to take action very, very quickly. Congratulations on that. And thanks, Neo. So now I'd like to welcome Shona Macdonald, so the founder of Shona Kip. So Shona, your sort of fight as a, if I can say, as a social entrepreneur has been the inclusion of person with disability into sort of different spaces. So tell us a little bit about these past 6 months for you, and what kind of new solution you've been developing.
Yes, thanks, Stephanie. Yeah, I'm Shona from Cape Town, founder of Shona Quip. And I think where we entered this challenge in terms of coming up with a new design, a new solution, was really stimulated through our existing work. So we manufacture a whole range of disability posture support equipment and work closely with World Health and with the South African government and a number of other surrounding countries, governments and non-profits. And through that work with people with severe disabilities, most of them mobility disabilities, we suddenly were faced with the fact that most people with such severe disabilities don't have access any longer during COVID to any rehab services or any schooling services, and were totally isolated. So besides putting all our training and our work online and trying to really shift the control of information from professionals down into the communities where it was needed, we also had to think of how could we possibly protect people with disabilities and their families when they were forced to get into the hospitals. And we were having stories of children with Down syndrome or autism, grannies with dementia, entering a hospital system sick and not allowed to take their family member into the hospital with them. And in most cases, those family members, the only people who really understood what that person's needs were, because many people that we work with cannot speak or have severe intellectual disabilities. So the level of terror and fear, especially being approached when you're sick with people wearing masks, you can't lip read, you can't read faces. How do you manage in that circumstance? So we started designing a powered respirator, which had a clear face so that people could see the facial expressions, they could lip read, they could really engage with the person that they were dealing with. And this really has now helped in many cases where, for example, hospital staff are having to engage with people who would normally really rely on an emotional contact in order to understand what was happening, not necessarily just listening and understanding. So during the design of this product, we also realized that the only alternative product like this was imported at more than 3 times the cost. And we could also use the income generation of this product through our production facility, which employs 30% of our team have disabilities themselves, but we could use the production of this to generate income to subsidize the cost of our getting all our training online and into video format, so that in future we can expand our reach of our training without having to get on site, and thereby reducing the cost and improving the reach. So these things happen. I've always felt that when there's a crisis, there's huge opportunity to change things, because things get stuck. We become complacent with the status quo. And I think when a crisis hits us, I stand up and I think, okay, what are all the things we could do? And I think, like Neo too, having a team of engineers and designers sitting there in the office saying, okay, now what? And this is what. Africa needs to be proud of raising the game in terms of medical device provision. We can do even better because it's appropriate for what's needed here. And I think for us now, I'm looking, I work with World Health on wheelchair standards. And I'm also now looking at how can we ensure that ISO is not the only measure of quality in this country, because ISO is often not appropriate for the rural environments in which it's needed to be used. And how can we improve the quality and change the quality of products that need to be used for people living in deep rural and rural areas, where access to repair and maintenance, and we need something better, we need something stronger in terms of our manufacturing and quality management in South Africa. And I'm inspired now to become part of that argument and that design and that solution, as well as just the wheelchair and assistive device provision discussions that I've been involved for the last 20 years.
Thank you, Shona, and congratulations also. I mean, thank you for reminding us of the silver lining of the crisis. And I think this is something that entrepreneurs can definitely do. Always see the solution part to a problem, or the half full glass. So we'll come back to your solution a bit later. But I'd like to welcome Moka for now. So Moka Lantum, founder of DBA, Checkup Medicals. You have so many organizations, Moka, that being a serial entrepreneur, that I always need to remember which one you are focusing on right now. So yeah, Moka, you are based in Kenya, so working also on access to telemedicine. So yeah, tell us about those last months for you.
Wow. First of all, I just want to share my emotions. Really proud to be an Ashoka fellow. Really, today is quite a special day, and it's sort of bittersweet, because in your bubble you think you're doing big things, then you hear of what they're doing, and then you hear of Shona, and you hear of Muzalema, and then you feel like you have not even started, and that I should go back and reapply for a stipend so I can start again from scratch. It's really a mixed feeling I'm having. And Neil, whatever you're eating at the beginning, you better share that recipe. It looks so good. I must say, I can just have to openly ask for that recipe. I think I'd like to share my sentiments as a business person operating a healthcare service in the pandemic, right? And as a business person, we had two choices, right? Either to chase the tender mask business, whereby everybody became a tenderpreneur selling masks and sanitizers, or really figure out what we are called to do as healthcare providers. And at the same time, facing unprecedented market forces, whereby delays in payments were pretty much affecting our cash flow. Employee logistics overhead was adding to our cost of service, where we had to make the decisions on who to let go, what services we needed to add, what additional support we need to give to our employees in the form of transport, PPEs, training, so that they catch up with the reality. Then the fact that now the customer had moved locations, whereby it was no longer acceptable for persons to come to the clinic for healthcare. Banks were not willing to give loans. A lot of the investors who were in due diligence process decided to stop the process and focus on their inherent portfolios. So it was a cluster F, if I may put it that way, where there was no path towards a future in March as a business leader. And so the fundamental things that we kind of had to kind of wrestle with have been addressed by my colleagues. And if I may summarize, was how are you going to handle your supply chain on the one side? How are you going to handle your distribution systems on the other hand, and survive as an entity? That really was the question at the beginning of the pandemic. And so, so from our perspective as Checkups Medical, we had to kind of rethink about our supply chain and how we are going to really get drugs to the patients that we serve on a daily basis. Now, the challenge for us really was a moment for us to reflect on our values. And let me explain the challenge from the consumer perspective. Now, people were losing their jobs. So that means affordability for medicines dropped dramatically. Now, before COVID, the message in healthcare was you must go to a public facility. You must go to a hospital. That is what access to healthcare meant. Go to facilities. And so the construct for healthcare was in a dispensary and health center in the whole of sub-Saharan Africa, people sitting bench, butt to butt, shoulder to shoulder, waiting to see a doctor. That is what healthcare was. That was the customer journey. Or you go to the big hospital and you sit there eyes on end waiting to see a doctor. Now, all of a sudden, those places are no longer safe. They are pretty much shut down, no supplies. Everybody's focused on ventilators and stuff like that. What do? That means the elderly people are most affected. Women who are pregnant are most affected. And then the last thing is that people are now staying at home. And obviously there's a hype in the emerging markets about telemedicine. And everybody assumes that everybody knows who to call, when to call, how to share your medical information, how to engage a medical provider online. If you look at it, just the numeracy and the literacy that is required for that engagement is enormously exclusive, inherently exclusive, structurally, systematically exclusive. And so we kind of had to think fundamentally, what are we going to do? Just another telemedicine app was certainly not the solution. We needed to find who are the right intermediaries to bridge us as providers to people in the home without adding more than 50 cents per delivery. So we were forced to think hard about our distribution model. And fortunately, by virtue of the different models that we get exposed to through conversations like this, we went and reached out to riders and said, riders, we need your help. You guys have to be partners in healthcare. And I remember the first conversations we had with riders. They're like, us in healthcare, we deliver. That's all we do. And so we partnered with riders. Long story short, we had to train them, equip them, and sort of give them the right tools to get into the homes as a new channel strategy to get into homes and distribute medicines. And in that process, train them on how to be interlocutors of telemedicine visits that they now feed into our backend systems. And the cycle now started where we have the riders go identify people who need services. They connect them with our clinic through telemedicine, and that's just a WhatsApp video call, no more sophisticated than that. It works just fine. We get the pictures, we have the conversations, they share their prescriptions, they show us pictures of what they're taking. We rewrite the prescription, we do telecons, and then we deliver. If they need to come in, the writer brings them in, and then we're able to serve them that way. By so doing, really increasing access without adding cost either to our side or to the patient side, and creating a happy experience with good quality. And for us, that's really something that we're proud to do. The writers are just God sent, amazing. And so we hope that now we can start thinking of more sophisticated tools. And really, I really like the Pele Box idea to see how we can now start scheduling people to pick up their medicines in locations, based on a predetermined schedule. I really love that idea. So there's a lot of opportunity for collaboration. Thank you.
Thank you, Moka. I love this idea of sort of the last mile for telemedicine, as you say. So there's a bit of a hype, but then how to make it accessible to those who need it most. So definitely super interesting to kind of repurpose riders who are doing all kind of things for access to healthcare. So I see already some questions popping up in the chat. So yeah, keep those questions for the speakers, and I'd be also interested in sort of social entrepreneur to social entrepreneur question. I think we have a small group, so maybe you have you want to share and ask each other questions or share insights as well. I think it's always a rich conversation. But before that, I'd like to hear also from all four of you. What are your top challenges sort of in the coming months? So, in order to develop those solutions that the ones that you had, the new ones that you have started recently with the crisis, but also your core work as a social entrepreneur. So what do you need most? Let's say, like we talked about access to technology, we talked about access to finance, expertise. So I'd love to hear from you also and bring us closer to your reality as a social entrepreneur in terms of what's top of mind and what are the top challenges for the months to come.
I know I just spoke, but really for me is that I am very concerned about our understanding of the customer needs, because the customer has changed, right? As I talked about affordability, location, how are people buying? How are people accessing medicines? And so really understanding the customer need at this time, right? And it's a deeper need because people are scared. When people want to get COVID tested, they're scared. Are they going to be hospitalized? Are they going to be contact traced? And so we have to play a defensive role as healthcare providers for our customers. How do you do that? And we're doing that in the backdrop whereby the core systems have not changed in terms of how fast are payers are willing to pay us, the insurance companies? How fast are the regulators allowing us to approve new technologies? So for example, if I need to get a pellet box to Kenya, what is the regulatory process? All of those things have not changed in terms of how fast they are. So really innovating and bringing new solutions to customers is a very difficult task under this mandate. And so our goal as a company and one of my core areas is just to kind of really try to understand our customer. And that is not easy to do in a market where data is very difficult to acquire.
Shona, yeah, please go ahead.
Yeah, I can come in there because I think, Moka, there's a great synergy with what you're saying for us, in that what we've found, we're sitting with two really big challenges. The one is we found that our clients, and that's parents and families of children with disabilities, they desperately need information because the information's tied up with professionals. But majority of families don't have a phone. And if they do, it's not a smartphone. So we launched during COVID as well, a parent network where we've created now parent champions who are able to connect with a number of parents in their local community. But to do that, we've had to provide phones and data. But we're luckily very close to our clients, and we have excellent feedback loops from that first mile back to us and from us back to them. But creating a network of parents that actually provides the support in the right language has been really, really successful. And the other big challenge we're sitting with is another one you touched on, which is the whole regulatory problem. We sat with our respirator ready for testing for 4.5 months till we got an answer from our local regulatory facilities on what we should be testing for. So we've wasted nearly 5 months waiting to find out what certification what testing and certification has to be done in order for us to get our product into the market. And that's a huge delay for us because we'd already done our field tests. We already knew the results of our product, but we couldn't get an answer from SAPRA or the NHRS or from TIA for that matter as to what tests we had to carry out. And it ends up that it's actually going to be quicker and easier for us ultimately to test it internationally. So and pursue an export market, which is ridiculous when the need is in Africa. So I think regulatory barriers is number one, and the other one is technology. We need to have access for phones, and in having phones and data, we're opening new pathways for other industries to come behind us, and that should be an absolute no-brainer in terms of funding.
Yeah, I echo both Shona and what Moka is saying. One of our biggest challenges really is what COVID has shown us is an overdependency on global supply chains, which led to shortages of PPE, and that's how we looked at technology, 3D printing, to enable us to ensure that the frontline workers that we work with were protected. So really, it's almost asking the question: how do we ensure that post-COVID we don't fall back on depending on the global supply chains, which have shown us that they're not reliable? We had orders that were pending from China or India, and were simply told that the West is calling, and they obviously their first priority for them as opposed to Africa. So it's almost now looking at the opportunity that's there to manufacture, products like 3D printed masks, face shield visors locally, and not depend on outside systems, because we can't really look at them, especially in building post-COVID. For us, where we see the opportunity really is strengthening our health systems, ensuring that we're able to replicate what we're doing in other parts of the country of Zambia and even other parts of Africa. Access to technology should not really be a hard sell, but we even had issues, importing the 3D printers, and even now we have shortages of materials. The need is there for us to be able to distribute, but where do we get materials in a quick enough turnaround time to enable us to work in the communities we're working with? So these are some of the challenges and some of the opportunities that we spot to really continue strengthening our production base, our manufacturing base, and not relying on, outside assistance, so to speak, or outside global supply chains.
Thanks, Muzalema. And a couple of follow-up questions on what you say and, the over-dependency on the global supply chain. Like, how do you see the possibility to be and to remain competitive, vis-a-vis China and, for example, and also if you start producing locally with 3D printers or other technology, what do you need for that? Do you need also sort of access to financing? Is it available locally, from the banks in Zambia, or, how does it work? Is it also sort of a second problem that you have to address?
Access to financing, I think is the prolonged pain point of social entrepreneurs, just ensuring that the money does not run out to enable you to carry out your work. One eye is on your beneficiaries. The other one is ensuring that you don't run out, so that you ensure the beneficiaries, keep having their products. One of the biggest issues we've seen is access to financing. We have the technology. We can see that our product works. Even with the baby delivery kit, the only reason that we started that really was because even the products that were coming in from China, from India, from anywhere else around the world, were not, pregnant women in our communities couldn't access them. they were too expensive. And we've been able to leverage manufacturing, some of the products in the kit locally, like we manufacture the biodegradable sanitary pads locally using local materials. It's already been standardized by ZABs locally here in Zambia. So those are some of the examples that can show that it can be done. And we've been able to reduce the cost of our kit that we assemble and package locally to over 60%. Being able to retail and sell it at the price point that our beneficiaries can be able to access, so that giving birth from a public hospital should not be looked upon as a luxury, but actually, it's a basic human right. So ensuring that we remain competitive is, being innovative and knowing our landscape. We know our landscape better than anybody else. So we know where the major pain points, where the next crises will hit. And that's how we always stay competitive in the game. And also ensuring that we have what they call is a cheap capital, cheap financing, really for social entrepreneurs to be able to carry out work, which is why I applaud the work you're doing at Ashoka with the Changemakers Africa Summit. Very excited to see what partnerships that we can build out of this.
Thank you, Muzalema. Again, very impressed at the reactivity and the level of creativity here. Neo, sort of turning over to you also to understand sort of, your challenges in the coming months. You mentioned that you were facing increasing demand. So on one hand, it's a very good news, but what do you need to actually deliver and have your solution in many more clinics at this point?
Yeah, I think it's been an interesting period for us. I'll start with the COVID testing booths, and I think Shona hit it in the nail in that you were responding, the innovation or the product was ready, and then you hit the regulation barrier. And I think Moka also talked about the fact that, at least in South Africa, there was this scenario where if you're not well connected, even if you have an innovation and you're not in the tenderpreneur sort of space, you find yourself somewhat an outcast if you're still trying to innovate and bring a product in the right way. And I think, and for us, that was a big challenge when we started positioning the booths. And I think one of the problems that we are also trying to answer is coming up with a response for COVID, but also in, like, let's say when you're now starting to gain traction, the COVID fatigue has set in, and people are starting to ask themselves questions around: should we just wait for the vaccine, or should we still engage and adopt certain products? And then I think that's an ongoing sort of climactical challenge that's there. And I guess within the context of the lockers themselves, so like we've been now working with the Ministry of Health in Namibia, and just I'm realizing that there's so many questions that one needs to be able to answer from a legal standpoint in terms to say, okay, fine, if I'm working in another country, what are some of the tax implications? And and all of a sudden, you as a founder, you're facing these questions and saying, okay, now I need to think about tax law, and then I need to think about importing into this particular country. Okay, is it the same as in Eswatini as it is in Namibia? So you're dealing with all of these, I guess challenges of saying, okay, if I need to do this, but all of these questions are directed at you, and you almost want to be able to say, how do I call a friend and say, hey, quickly, this particular question, how do I answer it? And I never thought that, let's say you travel to Europe and somebody will say, okay, data and privacy is such a big thing at that part of the world. And somebody's saying, okay, before you implement in Namibia, we want to know if you are GDPR compliant. I'm like, but that's a European standard. Why are we even talking about that? And I'm like, okay, but what standard are you compliant with? And then you're like, okay, I can comply with the South African standard. And then you go into, so I think it's been all of these questions that are at play around how does one scale, but scale in the right way, and answer the questions that are thrown at you rapidly. And to a large extent, you are still supposed to be the person who's calm in the room and saying, okay, this is how I think we can do it. And I think what I'm realizing now is that, or at least I like that sentiment of, if you do want to go far, you definitely can't go alone. And I think for us, this journey of trying to scale these pillar boxes has sort of created a lot of questions that we are now trying to answer. So in the grander scheme of things, I would definitely say that we are still trying to build out a scaling strategy that answers so many of the questions that are being thrown at us when you're engaging with different ministries. And I think it's so interesting how everybody looks to you to have the answer as a social enterprise that is focusing on creating value, and it is about opening up and saying how do we create a space where others can come in and say this is how we can answer that particular question.
Thank you, Neo. It seems that definitely the weight and the sort of the constraint on the regulatory environment is burden for all of you sort of operating from the healthcare point of view. So I think let's take 10 minutes now to engage with one another. Actually, I see a question from Jean-Claude. Asking, is there a second COVID wave right now in Africa, as there is in Europe? I guess that the timing is slightly different, but we probably need to prepare for a second wave. Neo, to your point, I think that's collaboration may become even more important in time of crisis, and also sort of inventing new solutions. So this could be also a question that I'd like to throw at you. If there's no other question from the audience, it's like, what are those new partners that you all would like to engage? Is there like a different type of partners that you don't have right now that you would like to bring on board?
I suppose I've got something that's been on my mind. I mean, we're all involved at some level with trying to shift policy and influence policy for change. And so many of my fellows that across not just Ashoka, but into Schwab and others, are sitting with the similar regulatory barriers, especially in Africa. And I wonder if that is an area that we actually, as a collective in the health sector, should be looking at ways to collaborate on, and that there should be a way to harness the connections within Ashoka and other supportive networks to review what is happening, because it's not possible to shift it on your own. You're just a victim of it. But it is one of those big systems that I think needs to be reviewed. It needs to become aware of the damage it's doing to the innovative sector, especially in healthcare and the areas I'm working in. Maybe I'm just biased because that's what I'm really aware of, but I think a collective effort there would be really useful, even if it was the building of a knowledge base and information to measure the effect it's having, and seeing how we can together push it forward.
Yeah, no, I couldn't agree more, Shona. I think that there's one initiative called the Social Entrepreneurs Alliance that was launched in the midst of COVID, and my hope for the silver lining of the crisis personally is that the role of the social entrepreneurs becomes more evident and visible. The role that all of you are playing to actually sort of build those systems, access to healthcare in Africa. Obviously, it was sort of highlighted in the midst of the crisis, but even beyond the crisis, that's my big hope, that we can keep campaigning and for the support to social entrepreneurs.
But even if one looks at the regulatory processes which we have to follow, most of them are based on European experience and environments in which product has to be used within a a cold environment or within a a very accessible environment. For example, wheelchairs, the testing is all ISO based. A chair with ISO testing is great, but it's not strong enough for Africa. Mm-hmm. We need to come up with our own standards that really are appropriate for the environments in which we need to use our products. High humidity, mud, distance from repair and maintenance services, shortage of spares. I mean, those are the things we need to be qualifying our product for, not a standard which isn't actually relevant for the places we work and the people who use them. Sorry, I'm very outspoken.
Sorry, Shona, maybe if I can go, just to add a very, very strong example for me to second your point. So right now, I have to make a decision, probably within the next week or so, to say, am I going to be pursuing our platform to be GDPR compliant? Because each and every room that I enter, whether it's Ministry of Health in Eswatini or Ministry of Health in Namibia, they're asking me the same question, and I'm thinking to myself, but how is it that it makes sense that I'm going to choose a European data management standard for Africa? And I'm thinking to myself, okay, but yes, South Africa has released POPI, but it's this question of asking the entrepreneurs or the people that are doing to meet the highest standard possible. And I'm thinking to myself, okay, I'm going to first have to try and find a resource that can help me understand GDPR and help me understand how I can implement it within. And I don't even operate any locker in Europe, and I don't even have plans to operate in Europe within a year. So it just doesn't make sense that I'm making this decision. And I don't have knowledge about this particular standard, and I'm then supposed to try and build capacity on it, because it is the thing that if I say we're GDPR compliant, it becomes a tick box. Yes, let's go ahead.
Mm-hmm. Yeah. Okay. So I'm seeing now a question. We have 4 more minutes. And sorry, Maria, that I couldn't, Mary, that I couldn't see your question at first. But there's a question about how do you keep track of the health data in your project, whether it's sending prescription, helping patients keep track of their health. So how do you access? Do you have access to real-time aggregated data, and how do you secure your patients' privacy? So that's a big question. So maybe if some of you want to share in a few seconds what's your experience when it comes to data.
Stephanie, I asked the question, by the way. Hi, I'm Mary. I think you invited us to come on to video and share a little time with you. Thank you very much. I know you don't have a lot of time. I've sent each one of you, by the way, a LinkedIn request invite. I'd love to connect with you. Neo, I'll just mention something quickly to you so that we don't go over the hour. I'd love to connect with you. I could help you with that question you just asked. I think a lot of the challenges I'm working with a great facility out in Ghana, and the whole point is really around how do you digitalize now health information, right? Africa has an incredible opportunity to leapfrog, and in many different areas, and health information is one of them. I mean, you've got Industrial 4 technology out there right now that is leading the way for us to now be able to very easily put information in the cloud. However, Shona, you mentioned that what do you do for people who don't have smartphones, for example, right? And how do those people then access that? But, Moka, all your drivers, they most likely have phones, right? They probably use GPS to figure out how to get somewhere, right? And those guys, we can also help equip them with the capabilities to be able to take that data that you guys have out there. I don't know if you've got a system today that you put all that data that you're collecting into, but it really goes right back to your point, Neo. So those guys are asking you, how are you going to privatize the data, right? And ensure through GDPR that none of that identifiable data is being accessed by anybody that it shouldn't be accessed by, you know. And anyhow, I know you're short on time, Stephanie, but I'll leave it at that. I've sent you each an invite on LinkedIn. I would really love to possibly chat with you a little bit more about that and see where I can help. Yeah.
Thank you, Mary. That's also one key issue, definitely the use of data and how can it be used to be sort of more effective and to understand the patient. So I think I'm afraid we're at time, but thank you so much for a wonderful panel. I keep learning, you know, every time I talk to you all. It was also inspiring to see again like how resourceful and creative you've been in the midst of the crisis. So keep up the good work. It's hard to be a social entrepreneur in general, but being a social entrepreneur in the midst of the crisis is definitely a challenge. So thank you so much for your courage.